I nominated Paul for this award for a few reasons. Everybody who works within our service is dedicated and passionate and caring. Paul takes this to the next level.
So my name's Paul Brannan. I work for Shetland Islands Council and I work for a service called Assertive Community Transitions, which is part of the Adult Services Learning Disability and Autism Service.
Paul's absolutely a worthy winner of this award because in the 38 years that I've been working with people with learning disabilities and autism and neurodivergent conditions, he's probably one of the best support workers I've ever worked with in terms of his knowledge, his passion and his dedication to this role.
My job is a social care worker practitioner, so that still involves quite a lot of face-to-face care of individuals who live with autism and learning disabilities. But my role kind of encompasses more of the care planning, the risk assessments, writing care plans.
I think it's an amazing thing that Paul is getting this award because of the hard work that he puts into his role, the difference he makes to these people's lives that he supports in the community.
What inspired me the most was definitely my little brother. He was a very big baby and he was asphyxiated at birth, which means that he lives with paraplegic cerebral palsy and he's non-verbal. So I've grown up caring for him over the last 24 years and watching him grow up and how he's grown to who he is today, how he communicates. It really inspired me.
Paul is very empathetic, but Paul is also really analytical, very focused on improving future outcomes, and he's been able to develop processes within our service that has made that infinitely easier.
What I love about my job is the people and supporting people who live with learning disabilities and autism and empowering them and enabling them when they may not be able to articulate or say how they feel. And if I can help them to say how they feel or say they're having a good day, then that's what matters most to me.
If we didn't have the funding to support the most vulnerable people in society, it would have a huge emotional detrimental impact on them. They would be unable to live within the community. These people might end up in secure hospitals or the justice system in places that they don't belong. The costs of supporting these people in these ways would still be just as high, except it would have very negative consequences for society, for the community and for the individuals. Withdrawing funding would not save any money. It would just mean that it would be spent through the police, the ambulance services and other crisis management services. Putting the funding in place to support these people proactively and to help them integrate in the community and contribute to the community saves more money in the long run, as well as being a much more compassionate human way to live.